Okay, there we are. It's every time. It's a miracle. Okay. Hello, everybody. Good afternoon. I am Lucy McBride. I'm an internal medicine physician practicing in Washington, D.C., as many of you already know. And today I am super excited to be joined by my friend and colleague, Michelle Palmer, who is the executive director of the Wendt Center for Loss and Healing, which is an incredible nonprofit in the heart of Washington, D.C., that well before the pandemic was doing heroic, incredible work for people who are grieving loss, who are dealing with trauma, and who are trying to heal themselves mentally and physically, frankly. And now more than ever, we need people like Michelle, and we need places like the Wendt Center because of the obvious pandemic. So Michelle, thank you so much for joining me today. I'm glad you're here.
I'm glad to be here, Lucy.
Thank you. And we have done this before.
We have.
Yeah, we've been talking about taking this on the road.
I think we should.
Yeah, talking about grief and loss is heavy, right? But may I say it can also be fun and enjoyable if you do it with someone like you, because it's always hopeful to make sense of trauma and to feel like there's things we can do.
Right.
So sometimes people say to me, why is it you're interested in depression and anxiety and trauma and all the physical manifestations? And it's not because I love tragedy, but because I think these things are important to name and then normalize and navigate. And when you see people recover gradually with help from people like you in the Wendt Center, it's incredibly rewarding. So I'm going to start by asking you some questions.
Okay.
Tell me about the current landscape at the Wendt Center. Like, what's happening there? What are people coming in for? And how does that kind of relate to what you've always done at the Wendt Center? That's a big question.
All right, that is a big question. So I'm going to break it down.
Please.
I'm going to start with actually what we've always done, because we didn't stop doing what we've always done. And so much of the work that we continue to do is really very specifically around non-COVID related grief and trauma. People were working really hard to heal the emotional wounds and the physical wounds of grief and trauma before COVID happened. And so that continues. I think specific to COVID, we're seeing a lot of anxiety and just sort of a lack of understanding what is happening to me, what is happening to my kids, what is happening to my friends. What is this experience called that we are all trying to figure out and navigate, and at the Wendt Center, we call it, this is a collective grief experience. And our level of grief will be different. But I think you would be hard pressed to find, frankly, probably anyone in the world who hasn't experienced some level of loss that's been related to this pandemic. And when I say loss, I'm talking far broader than just death. While death absolutely is a loss, and it's a devastating loss for lots and lots of people, there have also been a lot of other losses that I would say sort of in sort of a normal time, we might not actually pay as close attention as we are paying now. And I think part of that is because our bandwidth is really, really stretched. And when our bandwidth gets really, really stretched, our ability to tolerate anything that stretches it even a little more, much less a lot more, feels so intense, and really something that might be quite manageable really feels quite unmanageable. And so I think that, normally people would not necessarily come to the Wendt Center because they're navigating losing their job. But because their bandwidth is stretched and their natural support network, their net, that would normally catch them and love them and support them and cheer them, may not be as available during this time, because we're all managing a lot of other things.
I love what you just said in so many ways. One of them, the points that to me is really, really important is that, and I'll just double down on what you said, that death is a trauma, right? Losing a loved one. And as people know who are listening, we've lost 500, I don't know what the tally is today, but at least I think it's like 540,000 American lives. People have died from other things during COVID-19 as well, and grieving during a pandemic for whatever reason is extremely difficult. But your point is that death is trauma. But I think what people are realizing, and what I'm seeing in my patients every day, is the reckoning with other losses that they might not have considered trauma, as you just said. So people come into my office all the time, say with high blood pressure, or they're drinking more alcohol than they want to, or than they normally do. They are stressed, they have neck tension, they have jaw tension, they have low back pain, they're irritable, and they haven't had someone die, but they are managing teenage kids who are on Zoom school. They may be caring for an elderly parent. They may simply be distressed over the loss of the contours of their everyday life, going to the gym, commuting even. Like that was a little respite from work, or doing the dishes or the laundry or caring for kids. Point being that those are losses too, and those are relevant to the way you feel every day, and those feelings and those thoughts that you have affect your health in an important way. So my message to patients and to people who are watching my or reading my newsletter, et cetera, is that your mental health matters, not just because it affects how you feel every day, which is of course important, but it affects your physical health. And every day I'm witnessing the physical manifestations of trauma. And it's we need to name the grief and name the loss, because when if we don't acknowledge the very real human elements of loss, like, and the very, the fact that we've been robbed of the normal routines, and some kids have lost the senior year in high school, they've lost connection with their teachers, they've lost mentors at school, some of the kids have lost a safe space at school. Those things are losses too, and they are relevant, and we need to name them, we need to normalize them, and then we need to navigate them. And as I've been saying to patients all along during the pandemic, and frankly before the pandemic, but now, if not now, when? This is the moment to ask for help. It's a strength, and sometimes it requires added support like the Wendt Center. But as you also said, you guys were busy before the pandemic. It's not like you had nothing to talk about, right? Like trauma and grief and loss are universal experiences. I'm hopeful that the collective grief that we're experiencing allows us to look inward and see that we are all human, and realize that these things are relevant. So, I mean, you and I were talking just before you came live, that, like people will say to me, for example, who am I to complain? I haven't lost a loved one, and I have a roof over my head, and I haven't gotten COVID. Like, who am I to be distressed or sad? But yet I am distressed, I am sad, and my blood pressure's up. Like, so what do you say to people like that who are like, well, that doesn't count as trauma?
So first of all, trauma is actually not an event, which a lot of people think trauma is an event. Sexual assault, that's a trauma. That actually is not necessarily a trauma. Oftentimes it is, but trauma is actually an individual's response to an event that overwhelms their sense of well-being and safety. I think a strong argument can be made that COVID-19 overwhelmed our sense of safety and well-being. Some of us can manage and navigate that better, not even better, because I don't want to have like the misery Olympics, but
yeah, the suffering Olympics of
the
like,
suffering
there's
Olympics
plenty of
doesn't,
suffering to go around for everybody.
yeah, there's lots and lots of suffering. It doesn't serve anyone. Nor does minimizing your actual experience. Because somebody perhaps has it quote unquote worse than you, does that make you feel any better?
Correct.
Probably not. You know, it's really about, wow, rather than sort of judgment, if you can take the judgment out and just be present for the experience, like, wow, you know what? I'm sad. Not I'm sad, but my neighbor should be sadder, or, you know, not I'm sad, but I don't really have a right to this sad. Like you feel how you feel. And if you can step out of that judgment, it makes that emotional experience a lot better, a lot easier. As we all know, like judgment is really tough to take, and we tend to do it to ourselves frequently.
I think that's so true. And the other thing about minimizing struggle and minimizing one's emotions and experiences and feelings is that they're going to come out somewhere. You know, like if you have you know, if you're blue, if you're sad, and I'm not talking about mental illness, I'm just talking about not feeling mentally well, like you're anxious, you're sleepless, you're irritable, you're down, you miss the routines of your life, that stress is going to come out somewhere. It's going to come out like through relationships, like yelling at your kids or slamming the door or snapping at your spouse. It's going to come out in your body. It's going to come out in the form of like, you know, rapid heartbeat, poor sleep, weight gain. Not that weight gain isn't from other things, but let's face it, a lot of the weight gain that I'm seeing in the pandemic is because of emotional and stress eating. So my job isn't to say, tisk, 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 you've gained weight in the pandemic. It's to say, hey, what's going on? Let's talk about how to manage your stress so that you don't have the gravitational pull to, you know, late night eating or whatever it is. The point being that like, if you minimize your stress, if you can say like, well, who am I? Or even not even compare to other people, if you just don't countenance your own emotional health, then you run the risk of having it come out somewhere physically with a relationship. And then that's not good.
No.
And then you know, the wreckage, you know, follows us, right?
Right. So we do this great thing. So the Wendt Center, normally without a pandemic, we have a weekend-long grief camp called Camp Forget Me Not Camp Aaron DC. And the way that we start camp is we make a big circle, and I'm in the middle of the circle, and I have a seltzer can. And I am shaking the can, and I am talking about grief and why might we be at camp. And, you know, eventually a kid will yell, well, we're at camp because someone we love died. Yes, that's true. But why do we need camp for that? And then eventually a kid will say, well, because we have to talk about it. Well, why do we have to talk about it? And then I open the seltzer. And we do that because what happens when you open a shaken can of anything, we use seltzer so not to get sticky, because then we have a big water fight. But what I think about, and I love that metaphor, because the reality is we are all shaken cans of seltzer, and it feels terrible to spray on somebody you didn't intend to spray on, or to drench somebody you did not intend to drench, and to feel like you don't have control over it, just like that shaken can of seltzer.
It's such a good analogy. It's like, first of all, it makes you really thirsty. But also I'm like, I'm going to steal that analogy because it's so good. It's true. It's like,
yeah,
it's, you know, our bodies and minds are intrinsically connected, and then we relate to other people, and we bring with us to our relationships, you know, the stuff up here. And so like, you know, I was trying to put it to a patient this morning who's really in denial about her distress. I'm like, look, either you name it or it's gonna just hang around with you and come out in other places. And I'm just here to tell you it's normal. So let's talk about coping, because ultimately my job and your job are akin to one another in many ways, in that we want to empower people to use their self-awareness, use their internal narrative, and to talk back to anxious thoughts, and to kind of, like you talk back to, like you to grow the arsenal of coping skills that they have within them, which sometimes takes help, right? It takes sometimes a counselor like you, it takes one of the counselors at the Wendt Center, it takes a group. But let's talk about coping. Like, what are some of the coping strategies you recommend, say, to individual clients who are dealing with grief and trauma?
So there are a few. So I, a few years ago, started doing something I swear to God I would never do, and that is meditate every single day.
I know you were like the anti-meditator.
I was so anti-meditation, and then I became that seltzer can, and I had to figure out what are the ways that I can regain control over the content of what's coming out of my mouth, the volume of what's coming out of my mouth, just sort of my physical experience. And so I started meditating, and that was it really did shift. And I do it once or twice a day, usually 15 minutes. And it is enough for me to actually, I notice that I can hit the pause button in a way I couldn't a couple of years ago. And one of the meditations that I did is my favorite. It talks about your inner critic, and it recommends that you name your inner critic. So I'm going to go ahead. My inner critic is Miss Hadala. She is the most mean 6th grade teacher on the planet. And so when Miss Hadala gets super loud in my head, I say to her, Miss Hadala, I hear you and I've got this, because your whole point is to make me feel bad. And I'm not going to let you do that to me. And bizarrely, actually naming it kind of gives you, it gives you a level of space from it, which actually makes you feel better. Kind of akin to meditating is, we talk about mindfulness all the time. It's like the thing, right? But trauma practitioners have been talking about mindfulness forever ago.
Well, and remember, just to interrupt you, I mean, people sometimes, when I recommend mindfulness practices, including meditation, they're like, that's so trendy. And I'm like, well, it's a 3,000-year-old trend for a reason, because
exactly.
And I think it's just more a necessity of modern life. Take away the pandemic, but like with all the stuff coming at us 24/7, we need to be able to carve out space in our own minds for being present and being in the moment. So sorry to interrupt you, but yes, it's so trendy.
Yeah, it's right. And not only has it been around for ever, we now have neuroscience that shows the benefit of mindfulness in a way that we didn't have, let's say, 20 years ago. But any technique that helps you manage your breath and slow your respiration down. Right.
Breathing right now.
You breathe in for 4 and out for 4. Or you breathe in for 3 and then out for 6. But anything that modulates that breath and slows it down really does help you feel more centered. And when we get elevated and we're sort of, the brain is doing this and the body is doing this, it is very difficult to actually think through consequences and moves. And so that's when you find yourself reacting, because it's all going like this, it's all speeding up. It's kind of our body's way of saying, danger, Will Rogers, danger. And sometimes it's a small d, but sometimes it's not. Sometimes it's a large D. With, if you've had a pretty traumatic event and you get triggered, that's a large D. And so we want to figure out how to let our body know and our brain know that this is not real. I'm not in danger. I need to slow my heart rate down and my respiration down to help reinforce that I am, in fact, safe.
That's right. In my office, you might not be surprised to hear that I'm doing a lot of breathing with people. So one of the first things I do in a physical exam, we're masked and try to be distanced as much as possible, and it's a brief exam. But one of the first things I do after greeting my patient is take their blood pressure. And in the pandemic, the average blood pressure is many, many points higher than it normally would be. And people are just coming in sort of edgy, right? I mean, not only being inside, but being in a doctor's office, I'm wearing a face shield. It's like, and so we will sometimes do deep breathing. And I talk about the 4 corners breathing, where you take 4 breaths in and then do 4 breaths out and then 4 breaths in. I'm not describing it well, but the point is that after breathing, we recheck the blood pressure and it's normally a lot better. Sometimes it's not normal, and that's a separate issue. But the point is that those meditation breathing exercises literally drop the adrenaline and cortisol stress hormones that are coursing through your veins when you are faced with a threat, or when you are just in a stacked trauma situation like we've been, where you had hit after hit after hit after hit, and you just have all these stress hormones that are surging.
So the other 2 things I will say is, I understand that people want to know what's happening in the world. Rarely is there good news when you turn the television on, and you therefore you're not controlling what's coming into your space.
Yes.
And so be very clear and be very intentional about how much news you're consuming, the type of news you're consuming, how many notifications do you have on this little monster, because that is another way of really sort of overwhelming our senses.
Yeah, absolutely. And having boundaries around what you will take in, because we are so passive in what we ingest, whether it's on your email or the alerts, as you said, or just the news coming at you. Like, one of the ways I help my patients, and it sounds like you do too, to find calm and peace, and to therefore feel better mentally and physically, is to, prune your media. Pick a couple sources. You don't need to have like CNN on in the background all day. You don't need to get a notification morning, noon, and night. It's just not healthy. Not to mention, like, it's fascinating to have a front row seat to the pandemic and COVID-19 and all the emerging data, but the negative slant on the news is amazing. Because when you're actually in the field and the science, and you read people talking, smart people, journalists writing about the science, and you witness the pessimistic slant on the news, it makes me read the news that's not about things that I know about, with a much more critical eye. Obviously, we need journalism. Like, democracy dies in darkness, right? But like, we need to understand that the bad news sells. And there is a lot of bad news, but there's also a lot of hope. I mean, we could talk about the pandemic and the hope in a second, but just knowing that the news has a lens through which you don't necessarily need to be watching can be helpful.
I will tell you, I don't watch the news, and perhaps that this makes me uninformed. I think it makes me generally a happier person.
I think it makes you that's probably why you look so cute today. Because you haven't read the news today.
So my friends and my family know, like, if something big happens, to tell me.
Yeah, like, you're gonna find out.
You're gonna find out.
You're gonna find out.
Yeah. And I never feel like I'm missing out. I never feel like I'm missing out.
I mean, one of the things, there are other coping skills that I'm sure you and I could recommend, and just to like rattle some off, it's like being in nature. Nature has a calming effect on us. Being outside, just sitting outside, connecting with the sounds of birds and animals, and smelling the grass, and like, being outside is huge. So we need to do that, ideally every day. Exercise and movement are crucial for our mental health. Not only does that time kind of hopefully mean it's time by yourself, but it's time where you're discharging adrenaline, the stress hormones, and then asking for help. Asking for a therapist, talking to your pastor, talking to your friend, talking to your dog, talking out stress, journaling, but there's so many more therapists online nowadays. I think in person is always better, but they're more and more accessible. Therapy is more and more accessible. And, I wish insurances covered therapy better than they do, but I'm hopeful that, as policymakers and lawmakers slowly realize that mental health matters to our whole health, that will, improve over time. But so asking for help, being in nature, exercising, mindfulness practices, meditation, prioritizing sleep. Sleep is the glue for our mental health. Sleep is like, it's like free Prozac, it's just,
Right.
But it's hard to come by, right?
Right.
Especially if you're glued to Twitter before you go to bed, like I was last night. And as a result, I didn't sleep enough. I slept great, I just didn't get enough.
Right. Right.
But and then the other thing is giving people hope when it's allowed. So one of the things that has really been like bee in my bonnet, which is an understatement, during the pandemic is the negative slant on good news. It's inappropriate to give people, particularly in medicine in my office, good news that's not rooted in facts, right? To like falsely, be hopeful, to say, oh, it's not a big deal. Okay, you're gonna, that's not appropriate. It's not good for my patient. It's not good for me. But when the science is there and the facts of the matter are that these 3 vaccines, and we're gonna get 4, maybe 5 vaccines, are so phenomenally effective at crushing the disease, taking disease and hospitalization and death basically off the table, and turning the coronavirus into its wimpy cousin known as the common cold. Like, it's phenomenal. There's also clear evidence that the vaccines not only protect you from COVID-19, they protect other people from you. They reduce transmission. It's not, it's obvious. They can't eliminate the possibility that you could carry it in your nose, because that's an impossible ask of any vaccine. But the point being that the hope is really, really there that we will get back to normal. At the same time, there's going to be ambivalence and stress about re-entry. And that is its own set of, not to make everything like Debbie Downer, because there's obviously hope and joy in our future, but there's also going to be adjustment related stress and challenges. And so I wonder if you could talk about like what that's like for people and what you're experiencing and seeing in patients who are coming to you guys.
In a lot of ways, interestingly, the ambivalence about how to move forward feels very, very similar to the ambivalence from last March about how to move forward. And when people don't know how to move forward, it makes you feel unsafe, particularly if you've experienced a trauma. Traumatized people do better when they know what to expect, which is why, transitions are important. So first of all, just know that while this feeling of ambivalence feels similar to a year ago, it is a different kind of ambivalence. It is an ambivalence that is moving forward rather than holding us down. It is making things difficult, as an employer, trying to figure out when to reopen the Wendt Center and when I can do that safely and make sure the clients are attended to and the staff are attended to is hard and stuff that we grapple with. But the reality is that we will move forward. We've got vaccines. People are getting vaccinated. Now, with that comes a whole host of other things. And I say this not to minimize this at all, because it is real. And I'm going to use an I statement. I don't know how I'm going to put on pants without a stretchy waist and go out in public.
You and me both. I'm wearing the same pants today that I think I've worn every single day since March. I have, just so no one's worried out there, I have 3 pairs of the same one. They're black pants. It's like, but they just are in rotation. I don't know how I'm going to button my pants.
Yeah. Yes.
Wear high heels.
Yeah. Yes. We have to, we're like out of practice with like how to like be out in the world. And that really is what this is we are all needing to figure out how to start to be out in the world again. The image that has been swirling in my mind for the last few weeks is, if you've ever seen The Wizard of Oz and the house falls on the bad witch and Glinda the good witch comes and she says, come out, it's safe now. And all of the munchkins start to emerge from places you hadn't seen them. This is us. We are the munchkins and we are going to start emerging. The good news is we have time. You can titrate your reentry. There is nothing that says you need to go back to exactly what your life was before the pandemic. And in fact, this pandemic gave us some opportunity to make some changes maybe that we needed to, and to prioritize perhaps some things that we needed to.
Well, I love that. And maybe we would end on that note that, you know, it's hard, as you know, and I'm sure agree that like, it's hard to talk about like opportunity when we've lost so much. At the same time, trauma and the reflection upon it can provide opportunity for post-traumatic growth. So we can expect, I will see in my office, the physical manifestations of post-traumatic stress disorder. And that is defined in many ways. You don't have to have been, you know, pressed against the wall at a nursing home and witnessing your grandmother die from COVID-19 and not be able to say goodbye. That being an enormous trauma, of course. That doesn't, you don't have to have had that experience to experience trauma and post-traumatic stress. Post-traumatic stress can be the ripple effects of any loss, as we were talking about in the beginning. So I'm prepared to see the physical manifestations of post-traumatic stress for, you know, months and months, years perhaps. But you also can expect to see post-traumatic growth if you are lucky enough to be able to reflect on what's happening to you, name it, normalize it, navigate it. And one of the things, as you nicely just said, is that we can use this moment to think about, okay, what are the things that I had in my life that I would like to change? And maybe it's, you know, for some people, it's like, I realize that my relationship with my spouse is not healthy and I want to work on that. And some people might say, you know what, I never liked going to cocktail parties. I'm actually an introvert and I never gave myself permission to say no to events. And those are going to be different for different people. And but there is that opportunity to not only heal from trauma in a deep emotional way, but also to kind of think about and reflect on what life really means to you and what do you want out of it to the extent you're able to make those choices.
I think the other thing to remember as we think about reentry is for a lot of people, this pandemic has felt like complete and utter isolation. I will speak for me, it has felt like a lot of isolation because I live alone. It feels great to know that we're all going to struggle and step on each other's toes and manage this reentry together because none of us have ever done it before. And so we're in it together. And that feels great. It feels like I don't have to do this perfectly because nobody else is gonna.
That is for darn sure. No one is gonna, there's no playbook, there's no roadmap. And I think we need to expect that the road forward is going to be bumpy and long, and we should prepare to be surprised by sometimes by how we feel crappy, and sometimes we feel surprisingly good and relieved. But just to maintain self-awareness and awareness of others around us as well. I mean, one of the things that the pandemic has literally taught us is that things we do matter not only to our own health and well-being, but to matter to other people. I mean, it's like screaming with a megaphone, like, we affect other people, hello, you know, masks, vaccines, right? But in a very meaningful way, like we affect other people. And so hopefully it'll allow us to be more others focused. Obviously, that is a challenge for some people in this country to focus on other people as much as they focus on themselves, but we can hope that it gets better, you know, in that department as well. Thank you guys for watching and for listening to us. Someone said, I really like seeing live humans. It's nice. It's nice to be a live human. It's nice to connect with you, Michelle.